National Electrical Code Article 517.17 Code addresses lighting in patient care areas, specifying that lighting fixtures must have enclosed or gasketed lamps. Additionally, NFPA 99, specifically Section 12.1.2.11, states that luminaires installed in patient care areas shall be gasketed or enclosed to minimize the emission of dust, dirt, and microorganisms from the luminaire. Furthermore, NFPA 99 Section 12.1.2.12 explicitly prohibits the use of open ball luminaires in patient care areas. The purpose of these codes is to prevent the release of contaminants such as dust, dirt, and microorganisms into the air within patient care environments. Open lamps, like PA-R30 floods, typically do not provide adequate enclosure and can potentially introduce contaminants. However, there are exceptions to these regulations. One exception applies to areas where anesthesia is not routinely administered. Another exception may apply to emergency areas where enclosed lighting is impractical. If anesthesia is not typically administered in the cardiac catheterization lab, except in rare emergencies, open lamp recessed lights might be permissible, provided certain conditions are met. Firstly, the lights must be installed in a way that minimizes the risk of contaminants escaping into the air. Secondly, they should be protected from direct exposure to water and other liquids. Thirdly, you should obtain documentation from the hospital's Infection Control Committee approving the use of open lamp lights. To ensure full compliance with all applicable codes and regulations, it is strongly recommended that you consult with a licensed electrician and the hospital's Infection Control Committee before proceeding with the installation. They can evaluate the specific circumstances and provide tailored guidance on the suitability of open lamp lights in a cardiac catheterization lab. This consultation can help determine if an exception applies and ensure that all safety and hygiene standards are met. The National Electrical Code, or NEC, is a widely adopted standard for the safe installation of electrical wiring and equipment in the United States. It is not a law itself, but it is often adopted by state and local jurisdictions, making it a legal requirement. Article 517 of the NEC specifically addresses electrical installations in healthcare facilities. It covers a wide range of topics, including wiring methods, grounding, essential electrical systems, and, as we've discussed, lighting. The NEC is updated every 3 years to reflect changes in technology and best practices. It is important to use the latest edition of the NEC to ensure compliance and safety. NFPA 99, the Healthcare Facilities Code, is another important standard for healthcare facilities. It covers a broader range of topics than the NEC, including fire safety, infection control, and medical equipment. NFPA 99 also includes requirements for lighting in patient care areas, as we discussed earlier. Like the NEC, NFPA 99 is updated regularly. It is also important to use the latest edition of NFPA 99 to ensure compliance and safety. When installing electrical equipment in a healthcare facility, it is important to be aware of both the NEC and NFPA 99. These codes and standards are designed to protect patients, staff, and visitors from electrical hazards and to prevent the spread of infection. In addition to the NEC and NFPA 99, there may be other state and local codes and regulations that apply to electrical installations in healthcare facilities. It is important to check with the local authorities to ensure that you are in compliance with all applicable requirements. When selecting lighting fixtures for patient care areas, it is important to consider the following factors. Firstly, the type of light source, such as LED, fluorescent, or incandescent. Secondly, the light output measured in lumens. Thirdly, the color temperature, measured in Kelvin. Fourthly, the color rendering index, or CRI. Fifthly, the energy efficiency measured in lumens per watt. Sixthly, the life expectancy of the lamp. Seventhly, the ease of maintenance. And eighthly, the cost. LED lighting is becoming increasingly popular in healthcare facilities because it is energy efficient, long-lasting, and provides good light quality. LED lights are also available in a variety of color temperatures and CRI values. When installing recessed lights, it is important to use a recess gun that is rated for the type of insulation that is present in the ceiling. It is also important to ensure that the recessed can is properly sealed to prevent air leakage. Air leakage can increase energy costs and can also contribute to the spread of infection. When wiring recessed lights, it is important to use the correct size and type of wire. It is also important to follow all applicable electrical codes and regulations. If you are not qualified to install electrical wiring, it is best to hire a licensed electrician. When installing lighting fixtures in patient care areas, it is important to take precautions to prevent the spread of infection. This includes washing your hands thoroughly before and after working on the fixtures, wearing gloves, and using clean tools. It is also important to disinfect the fixtures after they have been installed. The hospital's Infection Control Committee can provide guidance on appropriate infection control procedures. Regular maintenance of lighting fixtures is also important. This includes cleaning the fixtures regularly to remove dust and dirt, and replacing lamps as needed. Regular maintenance can help to ensure that the fixtures are operating properly and that they are not contributing to the spread of infection. If you have any questions about lighting codes or electrical installations in healthcare facilities, it is best to consult with a licensed electrician or the hospital's Infection Control Committee. They can provide you with the information and guidance that you need to ensure that your installation is safe and compliant with all applicable requirements. Remember that electrical work can be dangerous, so it is important to take precautions to protect yourself from electrical shock. Always turn off the power to the circuit before working on any electrical equipment. Wear appropriate personal protective equipment, such as gloves and safety glasses. And never work on electrical equipment if you are wet or standing in water. By following these safety precautions, you can help to prevent electrical accidents. In summary, when dealing with lighting in patient care areas, firstly, understand and adhere to NEC Article 517 and NFPA 99. Secondly, ensure enclosed or gasketed lamps are used unless specific exceptions apply. Thirdly, if exceptions are considered, prioritize minimizing contaminant risks. Fourthly, obtain approval from the hospital's Infection Control Committee. Fifthly, consult with a licensed electrician for expert guidance. By adhering to these guidelines, you can ensure safe and compliant lighting installation in the cardiac catheterization lab.